I'm Seema Kumar, CEO of Cure, which is an innovation campus right here in New York City. We're a sister company of Deerfield, the largest investor in healthcare. And prior to Cure, I was at Johnson & Johnson for about 20 years. And Ambassador Birx, I remember the great work that we did on HIV and on so many other wonderful initiatives. And then finally the COVID vaccine. So thank you for the great comments here on stage. We're switching gears from the pandemic and the lessons we have learned, and hoping that in the future, as we look to healthcare, that we actually are going to transform healthcare. The future vision of healthcare is going to look very different from where we are today. One focused on innovation, focused on efficiency, focused on access and affordability maybe. And so with that, I'd like to, first of all, before we get into a panel discussion, we're going to hear a keynote from Dr. Eyal Zimmerman. Did I pronounce that correctly? He is the Chief Transformation Officer and Chief Innovation Officer of Sheba Medical Center and founder and director of ARC in Israel. So Eyal, you want to come on up?
So good morning, everyone. It's a pleasure to be here. C3 is about healthcare. It's about collaborations. It's about improving our communities. I think we all need to address the issue of the future of health and where is healthcare going globally. How do we answer to the many pressing challenges that currently exist? And at the first part of my talk, I'm going to be a little bit pessimistic because I'm going to talk a little bit about what we call existential threats to healthcare, or why, if we are not doing things differently, the next generation, our children and our grandchildren, might receive lesser healthcare services than we are receiving today, which is a very frightening thought. I'm sure you all agree, because typically we like to think about healthcare as always improving with the generations. We're receiving better healthcare than our parents and our grandparents, and our grandchildren will receive better healthcare, right? That's the usual notion, but if we're not going to do things differently, that might not be the case. Or another way to put it is that healthcare is on a train headed through a brick wall, and we need to move that brick wall or find a way to avert the crash before it happens. So this is only the beginning. We're going to get to a little bit more optimistic thoughts later. So as we talk about this, about the barriers to healthcare, what is causing this train to go towards this brick wall? There are many, many problems, as you can see on these slides. You're all familiar with them, of course. One of them is financial sustainability. I'll come back to financial sustainability in a second. But there are many, many others. Workforce crisis is huge, especially after the pandemic. Nobody wants to go and be a nurse anymore. I don't know if you've noticed this. People just don't want to go into nursing school. But still, regulations in the US, for example, demand that we have nurse-to-patient ratio that's fixed. And so hospitals today have to pay more and more to keep on the same nurse-to-patient ratio, which means prices are going up, salaries are going up. We're seeing nursing agencies take their cut and so on. And that's going to be a big issue. Even doctors don't want to go to be doctors anymore, at least some of the professions. So as we go into the future, we're likely going to see a growing gap in terms of healthcare professionals who actually want to go and treat patients for many, many reasons. And this is already happening today. We have a huge barrier and challenge with patient safety and quality. Patients are still hurt in hospitals. I'm sure this is not new to you. You know that you can come into a hospital with one problem and come out of the hospital with another problem, or sometimes not come out of the hospital at all. That's an issue that continuously is a major problem. We know about this problem for almost 40 years. We have not been able to solve it. The harm in hospitals, according to latest literature, has not been going down. It's actually steady or even going up. So again, some of these challenges that we're facing are existential threats to healthcare. We have to do something differently, and that's why my friend Dr. Bjorn Zoega, who started, said we have to do things very, very different and stop thinking about small increments of change. This is the cost paradigm. We all are facing a problem when it comes to the gap between existing resources to the resources that are needed. Every hospital around the world, you you go to the most rich hospitals in the US or around the world, and you talk with a clinician, they would always tell you, yes, there is a gap. We don't have everything that we need. And this is the reality everywhere. The problem is not that. The problem is that the gap is only going to grow, as you can see in this scheme. Because the existing resources are going to rise only a little bit, but the demand is going to grow tremendously because of many different factors. One of them is the aging of our societies, more chronic disease that we're not able to heal. Even this day and age, we're not able to heal somebody of diabetes. If you have diabetes, it's for life. At best, we'll control the disease. We're not making as much advances as we need on dementia and Alzheimer, and many, many other problems as well. So all of this will require more and more resources, so the existing resources versus the needed resources, that gap will grow, and this is exactly that train I was referring to earlier in my words. So basically, we've started this initiative, and we'll talk more about it on the panel, in 2018 called FOH, or Future of Health. And what is FOH? FOH has one thought, and that is, if we are going to see a better future for healthcare, then we better get our vision straight. If you ask anybody in this room, what is your vision for the future of health, each one of you would give another answer. We all have different views on where healthcare needs to go. You ask a hospital administrator, they will tell you hospitals need to be the center of the universe. They need to be large and powerful and have a lot of money, right? Because they run hospitals. But if you ask somebody from the community, they would say just the opposite. They'll say, well, the shift needs to move to community. Hospitals need to be smaller. Which one is right? Everybody has their view. You ask policymakers, they're worried about cost containment. You ask the industry, they're worried about their own income. So everybody has their own views. We brought together all these different stakeholders from 15 different countries. We want to get a global perspective on a leadership level. This is CEO level, that get together several times a year, virtually, and once a year, physically, to put forward a joint vision of what the future of health needs to look like. Only if we have one vision in front of our eyes will we have a chance to actually reach that vision. Because if we all go in different directions, well, we get havoc, right? And we're much less likely to get where we need to be. This is what typically happens. But with FOH, that was the task. And you can see who are the organizations that are part of FOH. This is an effort that's continuously going on. We're actually meeting on our next FOH summit in November in Cape Town in November of this year for the next FOH. And one of our partners is the New England Journal of Medicine, which you're all familiar with. And the work that comes out of FOH is published on the New England Journal of Medicine for everybody to use and read. And again, you can go through the organizations. You'll see the Joint Commission is part of this. CMS is part of this group. We have, of course, leading healthcare institutions, academia, policymakers, some health ministries like the Netherlands, Australia, and other countries around the world. So this is a very, very global effort, bringing together everybody, including patient advocates, because we need the patients at the table when we determine the course of the future of health. I mentioned the New England Journal of Medicine. That's the work that's coming out. You see an example of 4 papers out of 6 that we published over the last couple of years. And this is, of course, for everybody to use. This is not just for the partners of FOH, for the members themselves, but this is for the world to use as a common vision as we move forward on our plans to improve healthcare to populations. But vision is not enough, as I'm sure you'll agree with me. We want to see this vision actually happen. We're not satisfied with just sitting around in very nice hotels and venues like this and setting forward a vision. We need to move that vision an inch closer. We owe this to our patients. And this is why we started ARC. ARC stands for Accelerate Innovation to Redesign Healthcare through Collaborations. And the idea is to transform healthcare globally, around the world, using innovation, leveraging innovation to drive large-scale transformation efforts. That's number one. And number two, as we're going through that, we thought we're going to miss on an opportunity if we don't leverage innovation to also serve as an economic engine of growth. And we say economic engine of growth not just because innovation can bring in funds to the institutions themselves, which is great, but we say economic engine of growth because it has a ripple impact on our communities. When innovation starts startup companies, they raise jobs. These jobs are critical for the community. We train the young population on where we need them, on artificial intelligence, on bioinformatics, and so on. We have an impact on how much tax is collected from those innovations and commercialization efforts. And we're bringing foreign investments and some of the big industry partners to work with us and invest locally in communities as well. So this is an opportunity to grow communities and grow the economy beyond the transformation that's required. And only if we can achieve these two goals will we say that we've succeeded in where we want to go. So how do we have a chance at actually bringing about global transformation? We worked for about 3 years to put this together as a strategic plan to drive transformation and economic growth. And the plan is based on 4 fundamental principles. The first one is focusing on digital health. Digital health, as you all understand, is the main transformation vehicle that will have most of the impact on how healthcare will be conducted 10 years from now. This is where we need to put our efforts if we're looking to achieve large-scale transformation. And you'll see in a second within digital health where we're focused. Number 2 is focus on both open and organic innovation. Organic innovation is innovating from within our own organizations. We need to channel leading academic medical centers around the world to focus on entrepreneurship and innovation, to create solutions that we as the market demand today. We know the problems the best. The doctors, the nurses that work on the production floors of healthcare. You ask them, what's your problem? Where's your pain point? They always will have a long list for you. This is where we need to focus. We need to focus on real-world problems and create real-world solutions which can scale up globally very, very quickly, because we know in healthcare scaling up takes a huge amount of time. So this is something we have to focus on. So organic innovation is critical. Entrepreneurship culture is critical. But on top of that, you have to build an open innovation culture as well. We have to embrace new technology. We have to show proof of concept for whatever works. And if it does, have a system in place that allows for large-scale implementation and transformation. Without those mechanisms in place, again, it'll take us decades to get where we need to be. And this is something you have to invest in. You have to build in your local healthcare system that capability to run large-scale transformation efforts. Number 3 is international collaborations. We were looking for like-minded organizations. They're not easy to come across. Many organizations, healthcare organizations around the world will tell you, listen, why transform? We're doing perfectly fine right now. We have a good budget, we're making a nice profit, our boards are happy, our patients are happy. We don't need to transform. Why don't you guys, run ahead, maybe we'll catch up later. These are not the organizations we're looking to work with to bring about this transformation. We need organizations that are successful today, but realize that without change, they will not be successful 5 to 10 years from now. We know this in the industry. Every large company needs to have that foresight to look ahead, to be able to always be on the cutting edge and always lead in the specific industry. And healthcare is just the same. So looking for the right organizations globally around the world, you see some of their names in a second, working together to establish an innovation capacity to build new solutions, and then do large-scale implementations across the global ecosystem. We'll see in a second what that looks like. And finally, putting it all together in a structured approach that allows us to take the ARC methodology and the FOH vision and then implement them anywhere in the world that is looking to undergo this change. This is exactly what we did, and I'll show you in a second where we are today with those efforts. So these are the 5 areas we're most focused on as we're trying to bring about change. Of course, artificial intelligence, which was already mentioned, I think, 6 or 7 times since this morning. Of course, that's the buzzword today. We won't be able to go to lunch without getting to 10, so I hope we'll get to 3 more by that time. Artificial intelligence is by far #1 effort. And it is going to be the #1 game changer solution that will change radically how we do healthcare. But that's not the only effort. Precision medicine was already mentioned this morning. How do we find ways to predict and prevent? How do we find ways to treat precisely or predict who's going to develop what kind of complication on a certain drug? All of this is critical if we're going to be able to drive down costs. virtual reality, augmented reality, with some of the technology coming around, is going to create a huge change. We're using quite a lot today augmented reality in the surgical suite during surgery to improve our navigation capability as we try to excise the cancer tumor and take it out of the body. We found that by using artificial intelligence, we're able to drive down the length of surgery by 30%, which of course gets more patients to the operating room in terms of throughput and provides more accessibility to some of our patients, and many other applications as well. We do quite a bit of work on remote care. Where do we take telemedicine next? Is telemedicine only the video visits we're already doing every day? This is not the end of telemedicine, this is just the beginning. Where can we take telemedicine next? How do we turn the home environment into a health environment? We must spend most of our time at home. The older we are, we spend more and more time at home. That environment needs to support our entire health needs. So smart homes will have to be smart health homes. And this is a big focus we're going to have to have in the next couple of years. And of course more. I don't have time to cover everything here, but there's a lot we can cover on each one of those bullets. We create startup companies. Sheba Medical Center in 2024 is launching 20 new startup companies, each with cutting-edge solutions along the lines I've just mentioned. These startup companies and others coming in through the Open Innovation Platform, altogether more than 100 startup companies, they're here because they have a proven solution to drive the transformation needed and to get us an inch closer to the FOH vision. That's their role. And this is why we work with them throughout our global community. We work closely with the industry. You recognize many of the names here. These are the large players we're working very closely with to develop new solutions that the industry lacks and the market needs. We find that working together in this community allows us an edge in bringing about new solutions to the market. And finally, our healthcare systems around the world. And we had the honor of, again, working with Bjorn Zoega here out of Karolinska before his transition. And Karolinska is one of our proud institutions, as you see many others, Mayo Clinic, Mount Sinai here in the city, Cedars-Sinai, Mass General, Henry Ford, Thomas Jefferson, Cincinnati's Children, Houston Methodist. It's a long list of leading institutions around the world, not just in the US, but Canada, around Europe, Australia, Singapore, Bahrain, and South Africa and South America. So very, very global in nature, all like-minded organizations striving to reach this transformation we need to undergo. This is what unites us all, and there's a huge amount of work that happens between the names that you see here. But as I said, we've tried to pull it all together into one structured approach. When we started on day one, I said to my team, which was then quite small and grew with time, I said, listen, if we build the best innovation transformation program here at Sheba, but it's not scalable to other institutions, that we have failed. So everything we've done was with that in mind. And today the same methodology are implemented around the world. And you'll see exactly where. We have 6 ARC centers around the world that have either been completed or in the process of being built right now. In Chicago, we worked with Northwestern to build an ARC in the city of Chicago, an ARC in Ottawa in Canada, an ARC in London with Great Ormond Street Children's Hospital, one of the best children's hospitals in the world. We're building now an ARC in Bahrain, an ARC in Melbourne that would serve the entire city of Melbourne. This is not working with one hospital, but with several hospitals and several universities in the city. And an ARC in the city of Nantes in France with one of the best cancer hospitals in France that's going to open in December this year. We've partnered with Deloitte as a partner to help us scale this up because we've got huge amount of requests to do this, and with Deloitte, we're now working on the ground to building an ARC in Los Angeles with Cedars-Sinai Hospital, one of the best hospitals in the country, as you know, and also with the hospital in the city of Ghent in Belgium. And there's about 5 others that we're going to start over before the end of this year. That I can't mention their names yet, but we're about to sign 5 others in terms of contracts in many new countries we're approaching. So this is a global phenomenon, implementing all of these visions and methodologies to try and reach global transformations as required. Because at the end of the day, without transformation, Innovation will only lead to incremental change, and we know this. How many times have we seen innovation have small regional impact? How many times we're very proud about a very specific implementation of innovative technology, but it never scaled up. It remained focal in one area. Sometimes it died out even. This is our responsibility to make sure we can take this to a transformation level. That's exactly what we're focused on. We have a whole transformation map. I won't go through everything here because that's quite a bit, not for the time that we have this morning, but you can see here it has resources and strategy and mission and vision, and this is how we like to work. And within these, just to focus on what we call the high-impact transformational tools. This is where we need to focus because we don't have all the resources we need. If we need to choose where, this would be the place. From transforming decision-making processes, we need to improve our decision-making clinically and financially and administratively. Very much, that's number one, through the use of artificial intelligence. Redesigning professional disciplines. Critical. As the world changes around us, professional disciplines have not changed. They need to change as well. That's an effort we have to focus on. And this is where academia, of course, and training and schools come into play. Care without an address in terms of remote care, really taking away the barriers of geography. Geography should no longer be a barrier. It would have huge impact on health equity as we look at the world as a much smaller place. Precision medicine, I've mentioned, and patient empowerment. I could give you just a small example. And we have a very, very successful high-risk pregnancy at home program where we have pregnant women who need to be in the hospital because their pregnancy is high risk. They do their entire hospitalization at home, and you would ask yourself, who's doing the fetal ultrasound every day that we typically do at the hospital? Well, it's the pregnant woman herself. She is doing the ultrasound, and we have the technician online on the TV with her, guiding her, but never coming to the home. If that's not patient empowerment, then I don't know what is. And this is the role patients will play in the future. So I'm coming towards the end, and to share with you our local, and some of you that have been here in this round table that Orly, my colleague, has run this morning, everything that we have to think about in terms of the future of health is going to take shape physically very close to where we stand right now. On the banks of the Hudson River, on the side of New Jersey, where Liberty Park is, you're familiar with that area, not far from the Statue of Liberty. There's a new project, a state project called SciTech City. It's the city of the future. A very, very exciting project. If you haven't heard about it, I urge you to read. There's a lot online. Within this project, we have taken 2 floors on the top of this building to build a simulation lab of the future of health. So when you walk into the operating room on the 8th floor of that building, when you walk into that OR, it looks nothing like an OR you know of, because it looks like the OR in the year 2040 needs to look like. Bringing in FOH visions and ideas, bringing in cutting-edge technology and cutting-edge design principles, working with the best universities and medical centers in the New Jersey, New York, and Philadelphia area. All of that to converge in that top floor. There's still a little bit of time. This will open only in 2026, but we're looking for the right partners to come in and work on this very exciting project with us. And these are some ideas of what you're going to see there, including not just operating room and ICU and control room and clinic and home environment, the smart home of the future, but also what would a clinic in a developing country, in a low-income country of the future need to look like? How can we maximize the opportunity for a clinic in a low-income country so that we can leverage non-expensive technology in that framework to have the impact that we need? And there's a lot of examples I can share with you in that regard. So final slide, just to put it all together as a message. One is, we know that healthcare will need a whole new approach. We'll talk a little bit about it on the panel. That's going to be interesting in terms of where healthcare is heading. We know that digital health needs to be the main transformation vehicle. We've talked about that. I think after COVID, nobody is thinking differently. We understand why digital health needs to play that role. Transformation efforts will be faster in some places, like everything else around the world. Transformation efforts will be faster in some locations and slower in others. We want to make sure that we drive that change forward because somebody needs to take that leadership position. And this is where we're heading, and global collaboration will give us that chance to actually reach it within the next decade, which is what we're aiming to do. Finally, we need to be proactive. I say to my team, listen, in healthcare, and I'm a medical doctor myself, we're used to studying from textbooks, right? This is how we're taught. You're a student, you get your textbook, either it's printed or online, and you study from the textbook. As you grow, you realize that we can play one of two roles. We can continue to learn from textbooks, or we can write the textbooks. And I ask each one of you, on which side would you want to be? We've chosen our side, and this is what we want to do. Thank you very much.
Thank you, Eyal. That was really quite something. I mean, you painted a picture, you created the burning platform of why what we have today is unacceptable, but also solutions for where we could head in the future. So looking forward to the discussion here, a great setup for the discussion. Let me ask our panelists to please introduce themselves. Chip, do you want to get us started?
Well, it's good to hear Eyal, and I just went through the ARC Summit last week and saw what's obvious from what he describes, which is a future in which there's just tremendous opportunities. Opportunities to do so many more procedures and diagnostics and treatments in simpler, more precision ways, and we come away feeling very optimistic. And then we have, coming in November, our Future of Health Summit in Cape Town. And there we have, my experience, and I guess we've been doing this since 2018, first the future of the hospital, we turned into the future of health. We brought people together from around the world, and what's been striking to me is, particularly coming from the United States, which in healthcare is fairly parochial, is the commonalities. And that collaboration that comes out of these meetings, we think of, sometime here I guess we think about American exceptionalism, and I guess in healthcare there's exceptionalism every place. And that's what you see. And when you get away from the financing side, which tends to be different every place, and get to the care side, you see commonality, and you see the ability to have really collaboration and learning from one system to another. So it's been exciting being involved in both of these efforts that are really parallel.
So Chip, would you mind introducing yourself, or I can introduce you? You're the president and CEO of the Federation of American Hospitals, and also the co-founder and director of the board of FOH in the U.S. Tell us a few additional words about your background and how you got involved in this.
Well, I guess I go back to 2004 when I made my first trip to Israel and got involved with various people in the healthcare community in Israel. And ultimately, that led to me working with Sheba. In 2018, we began Future of Health Hospitals, and then Future of Health. In terms of my background, the Federation represents 20% of the hospitals, the tax-paying hospitals in the United States. HCA Healthcare is our largest system and the largest private system in the world of hospitals. Prior to that, I worked for the insurance industry at some points and also worked on Capitol Hill for many years, doing Medicare policy and other delivery policy related to taxation in the country. So I've had a background in representing partners and aspects of the healthcare system, and also spending a lot of time developing healthcare policy.
Wonderful. And Dr. Suja Matthews, would you introduce yourself as well?
Hi, Seema, and good morning, everyone. Suja Matthew, I'm Executive Vice President and Chief Clinical Officer at Atlantic Health System in New Jersey. I'm an internal medicine physician by training, and just real privileged to be here with all of you. And I'll say, very privileged to be part of FOH. You know, we spent some time in a previous panel talking about COVID. I would argue that this is just as contagious. You know, innovation and the enthusiasm that Eyal and his colleagues and we've all, you know, brought together in aggregate, it can be just as contagious and forward-shaking as anything we've experienced.
That's great. And obviously, people have heard from you. So anything else you want to say about yourself before we start the panel discussion?
Just briefly that, you know, I'm a clinician and internal medicine physician, and I spent my career between Sheba Medical Center and Boston, where I worked at the Harvard hospitals. And my background before I got into innovation, which is relatively, you know, not so many years ago, 2017 basically, I was very focused on quality and patient safety. That's where my passion was. I'm one of the founding members of the International Academy for Quality and Patient Safety, which we started a few years ago, and I've been completely very frustrated with the lack of progress we've done to turn to innovation to try and find the next solutions, and that brought this whole new world to my knowledge.
That's great. So, Chip, let me start with you. So, Federation of American Hospitals, right? So, it's important for hospitals and the healthcare systems to work as part of FOH, because the vision that was just laid out here, it's going to take everybody to come together to make it happen. So how do you see that working, and do you think that 10 years is a good enough time frame to see some progress?
We'll be looking into the future. I think we're seeing progress every day because obviously clinically there have been great advancements, but I think we're entering into this digital age where I think we've gotten a bumpy start with the proliferation of medical records, but we now have incredible data capacity and data ability. And the question that I have is, how are we going to tap into it to make it work for us and improve care and deal with the issues that Eyal's focused on in the past, making hospitals safe, and then moving on and making hospitals do a better job in terms of healthcare provided. And I think now with the advent of AI and other advancements, that we can tap into that data and really understand what we're doing much better. And I know in terms of the systems that I work with, they see this as the future. In some ways, I think there's a feeling among them that they've sort of pushed the organization side and the management side of hospitals as far as they can, and really it's understanding and manipulating and working with this data to really understand what's happening in the hospital is really the future.
Yeah, because I think obviously there's a lot of data, but now with tools like AI, you can actually mine the data and get the insights you need to make actionable plans, right? Suja, you know, Atlantic Health Systems, right? It's called health, not healthcare system. I mean, how is that different? And what do you do differently to keep people healthy and actually out of the hospital, not coming to the hospital?
Yeah, thanks so much for that question, Seema. So it's not Atlantic Hospital System. It's not even Atlantic Healthcare System. It's Atlantic Health System. And while we boast some of the best, arguably the best hospitals in New Jersey for care, we recognize that of the 1.1 or so million patients that we care for on an annual basis, 93% of those patients we're touching in the outpatient space.
Wow.
Out of the hospital.
That's phenomenal.
So we have that opportunity in the vast majority of our patients to really impact their health. And we take that quite very seriously. It's easy to say and very, very difficult to do because it requires a reframing of priorities and an investment strategy that again focuses on health, which isn't necessarily as revenue generating, right, as illness. So, my vision at Atlantic, our vision at Atlantic, is that when an individual enters our system through whatever portal of entry, that person is going to essentially imagine that they step on to a conveyor belt. And that conveyor belt will guide them to the care that that individual needs through extremely little effort of their own. And that's the system that we're charged with creating around them, so that they're actually moving to the point of care that they need. And importantly, Eyal is the great evangelist for, that care does not need to happen within the bricks and mortar, even of our ambulatory sites, of our offices. That care can happen in that patient's home. That care can happen as that individual is walking down the street, interacting with their smartphone. That care can happen through close collaborations with community-based partners that are working with that individual, living life, if you would, with that individual. So that's the future of health as Atlantic envisions it, and that's what we're striving to create.
That's phenomenal, conveyor belt, or you could call it like an AI co-pilot, right, that guides a patient through navigating this complex healthcare system. And patient empowerment is a big part of it. We all learned to do a little bit of that during COVID. We all swabbed, ourselves and sent our, tests over and, got test results. So how do we kind of take that forward in a much bigger systematic way? I was just fascinated by the example you gave of a pregnant woman doing her own, prenatal ultrasound along with a technician. I mean, that's incredible. Do you imagine a future the way Suja was talking about, where hospitals actually go away, they become smaller and smaller, and patients are empowered to take care of their own health in conjunction, obviously, with healthcare professionals?
Yes, we started, GP members as well in 2018 when we got together for the first time for FOH. One of the first decisions that was made was that hospitals of the future need to be smaller. We won't need all this excess capacity. Some countries in the world are actually already doing a very good job at that. I was visiting Denmark about 2 or 3 years ago, and I was meeting one of the major hospital CEOs, and I said, "What are you most proud about your achievements?" And he said, "I was able to drive down the number of beds by 25%. And that's opposite to what you hear in many other countries, because in many other countries, a hospital CEO would come and say, "Well, we were able to increase our hospital beds by 25%, that's the greatest achievement." So we're seeing that shift, and that shift has to happen for many, many reasons. Hospital is a very old notion. The idea that we pull patients together under one roof was something that was true for maybe 200 years ago. As we think about the capabilities we have today, that's going to need to change. So what is going to remain in hospitals will always be there, they won't disappear. They need to continue and treat the most complex patients. So if you cannot do your hospitalization at home, you'll need to be hospitalized at the hospital. But that's going to be only 10 to 20% of the numbers of patients we see in hospitals today. Of course, ICUs, we don't see those happening at home, right? So ICU will need to stay at the hospital. And even surgery, we'll see hospitals lose most of the bulk of surgeries. 90% of surgeries that exist in hospitals today will move out of hospitals into ambulatory surgical centers in the community. The length of time of surgery, a surgery that today takes 4 hours to complete, 10 years from now will take 1 hour to complete. And the patients will need to stay overnight. So they'll come in, they'll wait 2 hours pre-surgery, they'll go through 1 hour procedure, they'll wait 2 hours after, they'll go home. Today, 4-hour surgery, overnight stay, that's why it's very expensive, that's why we need the whole system in place. So as that transitions, we're going to see a lot of the hospital utilities leaving the hospital, but the most complete cases will always remain in the hospital. I guess heart transplant, especially robotic, will have to stay in the hospital for the foreseeable future.
A question for all of you. What's sort of like the crux of this transformation? You began by talking about digital health. And what makes it possible for us? What kind of an inflection point do we find ourselves in that allows us to imagine and actually make this transformation happen. Chip, let's start with you.
Well, I think where I was going with my comment earlier was that, be careful with how I say this, but I think in a sense, traditionally medicine has been relatively blunt as it's treated patients. There was a way to treat certain conditions, and the surgeon or the physician did the best they could under the circumstances, and they were playing a common denominator. And I think that in the future, what we're going to be able to do with understanding data better and with all the technologies that are being developed is really have what's been discussed in maybe in sort of faddish terms is precision medicine, medicine designed for that patient's specific condition. Yes, all blockages of the heart are not exactly the same, and I think we'll understand that better and better in the future because of our ability to bring data to bear on top of treatment advances. And I think that's the biggest difference, and that relates back to digital, and that relates back to having the capacity to do the kind of analysis that we could never really do before. One good example of this is over time there have been improvements, but I think not far off we'll be able to, in an area like sepsis, detect it immediately, understand it completely, and deal with the various forms of it as it affects patients, and remove it as a problem. And there are other kinds of illnesses that I think we're going to be able to deal with because we'll be able to understand them better than we do now.
Yeah, so going from a one-size-fits-all approach to something that's more precise, the right patient for the right treatment, for the right patient at the right time, and quicker and faster and easier. Suja, what about you?
Yeah, I'm going to build off what Chip said. I think it's all about the data, harnessing the data for accurate prediction and intervention. So it's, one of the main projects we're working on is collecting all the data we have on every single patient, bringing it together in one data set. I was thinking about, within the last 6 or 7 months, I was at an event sitting at a table alongside an individual from the consumer products industry. And she commented to me that it's unthinkable to her that healthcare doesn't know more about our patients, because in the consumer products industry, they can tell you who's going to buy this particular toothpaste based on other purchasing patterns that that individual has demonstrated. That's data that's available to us now. So at Atlantic, what we're doing is building what we're calling, imagine it's like a patient 360 view, right? Everything we know about our patients, so that then, including the genetic piece of it, so what we traditionally think of as precision medicine, but the behavioral aspects, right? The socioeconomic elements, of course, every element of their EMR, their clinical conditions, but financial aspects, right? Payer elements of their decision making, so that we can actually predict who's going to get that breast cancer screening. And importantly, if we know that someone is at a risk to not receive that screening, how do we intervene? And what's the best way? Is it a phone call? Is it a text? These are all elements.
Culturally appropriate and culturally competent.
All of that, absolutely, all of that. And so, again, building off what Chip said, it's data and harnessing that data to predict and to determine treatment, all data.
That's good. Neil, your thoughts?
So, again, going on the same line, data obviously is critical. I think the challenge at the end of the day will be tying it all together into something that's completely seamless. So let's take an example. If I'm a patient, I live my life, I work, I have my family, and I might have pneumonia. What is the process we go through today to get diagnosed for pneumonia, then get the treatment we need at the pharmacy, and stay at home or whatever, go to the hospital to get that treatment? each of us have this vision in our head of what that looks like today. Now let me paint that in a very different vision of what we think can happen in only 10 years. Then we all will have an avatar on our phone. The avatar will control 95% of our health issues. 95% of our health issues. We will not
The
be
avatar is a doctor?
No, it's an AI.
Okay.
Okay? I have, by the way, we have an AI avatar at ARC. I just had a birthday 2 days ago. I got a birthday song from the avatar. And he knew exactly what my hobbies were, and he said, good, better luck next time when you go fishing, because he knew how many fish I caught. This is real life. I could put it on the screen so you would see. But that already exists. 10 years from now, that avatar will care for 95% of our health needs. We only need 5% where we bring in the human in the loop. That 95% that avatar will know when we have pneumonia, will do the diagnosis, and our home, we won't even need to leave our home through our smartphone for pneumonia. We'll know the severity so that we don't need to go to the hospital. We can take treatment orally. We don't need IV treatment. We'll send to our home somebody with the pills. We'll take the pills. We'll go through, and we'll be monitored every day so that if things change and maybe we need to bring somebody into the house to actually examine us, the whole pathway of what happens in diagnosis and treatment and follow-up is going to look very different, and I would say the most important word is seamless. Because today, as we navigate through healthcare, and we go through all these stops, all these different people we meet along the way, it's always clunky, right? It's never really streamlined in the way that it needs to be, the way some industries have already done. When you buy something on Amazon, for example. This is where we're going to have to go. Amazon, by the way, is looking to go in that direction, as you know, with purchasing One Medical and others. So maybe they will deliver this promise to the world. But I believe that in 10 years, this is what medicine is going to look like, and it's going to have a profound impact on our lives.
So I'm going to switch gears and ask each of you a question that is sort of outside of the science and medical part. Because, Chip, as you know, and as we heard from the previous panel, data, science, health, AI, all of that is great, but then you have to overlay that with policy, with politics and all of that. How do we need to get policymakers involved? How do we need to make sure that governments and some of the things that we do to enable this also happen simultaneously?
It's a wonderful question.
Yeah.
And that's 40 or 45 years of my life trying to figure that out. At least in the American context, I think we've been through sort of every possible shade of reform that we could go through. I do worry whether the politics of today, which I personally sort of see as sort of superficial, can deal with some of the complexities that we're talking about in healthcare. I don't know how good a job we did. I don't know how good a job I did when I was involved in policy making a number of years ago. But I worry today whether, in a sense, the policy making is keeping up with the advancement. I worry that general concerns about AI could get in the way of advancing the ability to innovate with it, at least in the healthcare area, to really make the data sing in ways that will be helpful if we over-constrain it, because I don't think we know everything it can do yet. Clearly we don't. So and then the issue in our context and other contexts is, will there be the resources to pay for these advancements? May ultimately reduce the cost of healthcare and reduce illness and the length of time of recovery. But unfortunately, up to this point, my experience in healthcare has been new technologies always seem to bring new costs rather than cost savings. So I can't give you a confident answer to that. I wonder sometime whether the healthcare system succeeds for us despite the policy making rather than because of the policy making.
And, what about bringing policymakers into the fold as a co-partner in the effort, right? That would be one thing to think about.
And that's always been the objective. And we'll have to wait, we'll have to see whether that works. They have other motivations and they come and go. They don't seem to stay as long. In my youth, when I worked on Capitol Hill, we had members of Congress and the Senate who were there for a long time and spent a lot of time focusing on healthcare and produced things in our context, like the diagnosis-related groupings, payment in Medicare for hospitals. It's actually one of the reforms that's worked very well in terms of keeping length of stay down and providing resources to hospitals. Politics isn't the same today. It doesn't, and there used to be more consensus around healthcare. We'll have to see how that comes out. I wish I could be more optimistic, but at least in our context, I'm, I guess, getting curmudgeonly in my old age and not feeling as confident about our leaders.
Okay, we hope that things will change and that the vision and the future of a bright a healthcare which costs less and keeps people healthy will convince our policymakers. Suja, there's also this issue of access and equity. How do you ensure that all this stuff is not just for those who can afford it and those who have access to it? Because there's still, we talked about people in low infrastructure countries, but right here in New York City, access can be an issue.
None of us can afford it. I mean, that's the reality. Our system is not sustainable. And Seema, you're right. Spent over 2 decades of my life working directly in a public hospital system caring for underserved. So I have a deep passion for the poor. And yet, I will say it is not just the poor that we need to be concerned about. And equity is really about, what for everyone to reach an agreed upon outcome, right? Optimal health. We need to spend time to understand what keeps each individual from obtaining that. So in some cases, those are socioeconomic in nature, and those burdens are much greater. In other cases, it's health literacy. It could be transportation challenges, geographic variations. We talked about healthcare in the south of America versus the north of America. So all of that is to be taken care of. But I would come back to the point that it's we need to be thinking about value, because the value equation, quality, experience, access, divided by cost, right, is very important for every single American and arguably everyone around the world. So it's it's an issue for all.
It's an issue for all of us. Let me make sure we get a couple of questions in from the audience. Let's see. Does anybody have any questions for the panelists? We have one.
So the comment you just made, I actually want to ask everyone, and I'm not a plant in the audience, even though I sat here the outside. Can you all hear me with that? Can you hear me with that?
No.
How about now?
Yes.
I'm not a plant, I was just saying, even though I know Chip and Al. You just made a comment that really brings back to the whole fact that this is as much a logistics and supply chain issue. Time, distance, all of that needs to collapse and converge. So if each of you has one or two innovations that's not medical that you've seen recently at the ARC Summit last week or in your travels that you would like to bring to us, I'd like to hear what those are, because again, I'm not a medical professional, but I am focused on technology and innovation. I'd like to hear what you've seen out there that should excite us, please.
I can speak to that, and some of you are going to be very familiar with this. You're maybe not a physician, but I suspect you're a patient or you know a patient. Most of the patient experience these days when they go in to see a physician involves speaking to the physician and an inability to maintain eye contact with that physician because the doctor is so concerned about documentation, etc. So I would argue something that's fairly simple and yet potential to revolutionize is ambient voice technology for documentation. We're beginning to pilot some of that at Atlantic, and meaning these are vendors that are in existence out there with very favorable responses by patients and by the clinicians. And if you think about it, probably most of us are aware of the tremendous burnout and lack of professional satisfaction that exists among physicians and other clinical workers, which is its own threat, right, to the future of health.
Well, maybe not a technology, but just a concept that we're playing a lot with right now. We're building a new hospital, and for a chief transformation officer to build a new hospital is a dream, right? That's what we all can achieve. How do we build a new hospital different than the existing hospital? How do we think about this completely different, and rather than build the same thing we've been doing for the last 100 years again and again? One of the things that we're trying to learn from in our airports. How many of you have got lost in a hospital? That happens every time. I mean, if you haven't got lost in a hospital, it's not saying anything about your sense of direction. It's mostly saying that you probably have not been in hospitals, which is always good. But think about airports. Airports are also potentially very, very complicated to navigate. But then in airports, it's much easier. They figured this out. They have a mechanism in place that works very similar in almost every airport around the world. They have gates, right? They have terminals. We haven't seen gates in hospitals. Nobody says go to gate number 12, right? So maybe we should build the new hospitals as airports. And typically airports have also a better, reputation in our minds than hospitals. I'd much rather be in an airport than a hospital, as a consumer. Typically we think about vacation and traveling, right? So the more hospitals look like airports, I think that's going to be great for the navigation, for the overall mindset of people coming in, and so on. So just an example that's been on our head.
We have we have several more questions. I think we're a little bit out of time, but maybe we'll take two questions. If you had your hand up first.
I was listening to your comments about physician burnout, and I've had the pleasure of working in public health for about 30 years, and I've worked with some luminary physicians out of Johns Hopkins, and one of them happens to be Dr. Nair Wong. He's somewhere over there. Dr. Wong invented an outstanding technology, which is an AI-enabled scribe. So the scribes, there's about 200 of them, and what we're doing is helping women who are culturally isolated in Pakistan, being able to work out of their home, yet they're already scribes, and they've been further certified to be radiological scribes. And we're working with one of the largest radiology companies in the world, Rad Partners, and other hospitals. So this technology you're talking about for tomorrow exists today. Dr. Wong has several patents. He's a graduate of Harvard University. By the way, I've known him for 50 years. We went to junior high school together. And he also taught at Hopkins, and he's a professor there the associate professor of interventional neuroradiology. So there's a lot of things that exist, and I'm very glad I'm here because I love innovation. I've just been asked to join the founders board for Road Medical College. So I'd like to see how for Road, now I'm speaking for Road Medical College, how we can work with your team. And this has been one of the most enlightening panels I've heard in a long time. So thank you for having me.
Well, thank you to the panelists. We're way out of time, so I think the panelists are going to be around here, so catch them at the lunchtime or in a break. Thank you so much for a great